So I am doing my video project on epilepsy and seizures. So overall, epilepsy is characterized by clusters of neurons that signal abnormally, and sometimes these neurons fire as many as 500 times a second, whereas the normal rate is 80 times a second. So it's characterized by a large increase in neuronal activity, and this increase in neuronal activity can cause strange sensations, different emotions, different behaviors, sometimes convulsions, muscle spasms, and sometimes a loss of consciousness in the person. Some of the current thoughts on the causes of epilepsy: it could be due to an abnormality in brain wiring. It could be an imbalance of neurotransmitters or a combination of both of these things. So in this video, I'm going to more talk about the imbalance of neurotransmitters. And one other big thing that I want to establish before we get started is the difference between an epilepsy and a seizure. So seizures could be provoked or unprovoked, in which a provoked seizure is characterized by or usually caused by some kind of a trauma, infection, a tumor, an electrolyte imbalance, or withdrawal, along with other causes, whereas an unprovoked seizure typically has no apparent cause. And so when we get into epilepsy, it's typically characterized by 2 or more unprovoked seizures, putting the person at risk for more future seizures. And so going on, I just kind of drew a diagram here of a typical neuron, just showing how it fires an action potential down the axon, and then it's either going to excite or inhibit the next cell in line. And so, like I said before, epilepsy could be caused by an excitation-inhibition imbalance. So there could be too much excitation going on, or too little inhibition, which causes many neurons to fire at once uncontrollably, and this ends up causing hypersynchrony in the brain, which, like I said, can result in many different symptoms, causing movements such as the muscle spasms. It can cause the person to become unconscious, and sometimes they can hear different sounds. They can smell things that aren't there or taste things that aren't there. So then moving on, this is the seizure threshold. So this is the person's likelihood of having a seizure. So the higher the threshold, the more likely the person is to have a seizure. Some factors that actually increase this threshold and make it more likely for a person to have a seizure include them missing a medication, sometimes lack of sleep and illness, alcohol and drug use, hormone imbalances, stress, and sometimes sensory input. So at the bottom here in the purple, we are in the low risk category. Basically, a person's every day, they have taken their medications, gotten enough sleep, are not under any stress, etc. And so then we move up into this blue category here, in which the person may be in a time of stress. They may have a lack of sleep. They may have stress because of job loss and other types of things. So this stress level causes increased arousal of the sympathetic nervous system. And then so moving up into the green here, we are at risk factor for having a seizure, in which there is a general increase in epileptic activity. And then we move into the yellow trigger zone. And so this is usually triggers such as forgetting to take a medication. Sometimes this is those sensory input triggers. And so here we typically get an induction of epileptic activity. And then moving into the orange category is the warning signs category, and sometimes here you can get auras in which a person might know that a seizure is coming. So the auras are typically characterized by strange sensations and feelings. And then moving up, the red is obviously when a seizure occurs, and this is the outspread of epileptic activity within the brain. Moving on, there are many types of seizures, but the two big types are generalized and focal or partial seizures. And so in the generalized seizure, the whole brain is going to be affected, whereas in a focal partial seizure, only one brain region is affected. And so sometimes these are characterized by the brain region in which they affect. So it could be a frontal focal seizure, or it kind of depends on where the seizure is at. So we're going to start with the focal partial seizures. And these are seizures, again, in which one brain region is affected. And with these seizures, you can have a simple focal, in which the person remains conscious but experiences unusual feelings or sensations. They may see, hear, or taste things that aren't there. And then there's a complex focal, in which there is a change in or loss of consciousness, sometimes a dreamlike experience, and they can have repetitious behaviors such as blinking, twitches, or mouth movements. And then in this generalized seizure, again, the whole brain region, or the whole brain is affected, and it's characterized by abnormal activity in many parts of the brain, causing loss of consciousness, falls, or massive muscle spasms. And so sometimes people just have a focal seizure to start, and then it can progress into a generalized seizure. So sometimes it's not just one or the other, and a person could have both at once. Moving on to this drawing that I drew, this is just trying to show the basic neurons that are involved or thought to be involved in epilepsy, so it is still being studied. So they don't know for sure that these are the neurons involved, but it's kind of what is expected. And so up top here is the glutamatergic neuron and the GABAergic neuron. And this is an inhibitory neuron which releases the neurotransmitter GABA to bind to GABA A or GABA B receptors and cause an inhibition in the brain. So this is thought to be decreased in epilepsy. And then there's also the glutamatergic neuron at the bottom, which is an excitatory neuron, and it releases glutamate here, and it stimulates AMPA, NMDA, and KA receptors to stimulate some kind of excitatory signal in the brain, and this is thought to be elevated within epilepsy, causing more of that neuronal signaling. And so this figure here, I'm trying to explain some of the different treatments. These are the long-term treatments to try to prevent seizures in epileptics. And so this is a diagram of a glutamatergic neuron synapse. And so as you can see, up here is the presynaptic neuron, and down here is the postsynaptic neuron. So first I'm going to start with the presynaptic neuron treatments. And so we have phenytoin, carbamazepine, lamotrigine, lacosamide, zonisamide, and oxcarbazepine. And so these medications all block the voltage-gated sodium channels to try to block glutamate from being released from the presynaptic terminal. Next, we have levetiracetam, and so this medication is targeting the synaptic vesicles, and it is thought to reduce the amount of glutamate released from the vesicles into the synaptic terminal. Up next, on the postsynaptic neuron, we have perampanel, and so this drug tries to work by blocking the AMPA receptors from being activated and stimulating downstream effects in the neuron. And then we have felbamate here, which is blocking the NMDA receptors and also stopping it from creating downstream effects in the neuron. Moving on, This is the last diagram I have for you, and this is showing the effect of benzodiazepines. So benzodiazepines are typically used in an emergency setting to stop a seizure while it is still occurring. I work in EMS, and so I've seen these used a few times to actually stop a seizure. And so these work by agonizing the GABA A receptors, and in which increases conductance through ion channels. And so again, I just brought up my little diagram of the GABAergic neuron, and I'm reminding you that it is an inhibitory neuron, and it releases GABA normally to stimulate the GABA A receptors to cause an inhibitory effect. And so when we give a person benzodiazepines to stop a seizure, they are going to come in and actually bind the GABA A receptor, and they are an agonist for this receptor. So they are going to stimulate the receptor and cause an inhibitory effect in the brain.